This is NBC6 South Florida Today.
Welcome back, everybody. Tomorrow, NBC6 is holding a cancer interactive phone bank and a special television event to keep you up to date on the latest advances in the ongoing battle against this deadly disease. But today, Dr. Nicholas Tranicus of Broward Health and Pauline Grant, who is CEO of North Broward Medical Center, are here with a preview. Welcome to both of you.
Thank you very much.
Well, what kind of advances have you made in the detection, early detection and treatment of cancer in the last few years?
Well, what we have been doing at Broward Health is really upgrading all our cancer services to the community. We have invested tremendously in our equipment, in our radiation equipment, and all our services. We have board certified and fellowship trained surgeons like Dr. Tranicus, who are there to really make sure that we are quickly detect any cancers and treat them very aggressively. And the important thing is that it's right here in our backyard. We can do all of these services and provide these high-tech services right here in Broward County. We don't have to leave. We can have them right here.
That's where I was going next, because a lot of times when people get serious diseases, they think they have to go to Boston or Texas or somewhere else to make sure they get the very best care. You're saying that you've got care as good or better right here? We
have care as good or better right here in Broward County. And I'm sure that Dr. Tranicus will elaborate on that. But just to give you an idea of some of the advances in our equipment, we have a CyberKnife, which is a robot that is able to deliver high doses of radiation to specific tumors like the brain, the lung, prostate. We also have new image-guided radiation equipment, which again is state-of-the-art and is able to detect and treat very aggressively by our surgeons, who are all very qualified. And again, it's right here in Broward County.
Doctor, I've got a friend right now who went to Texas, I think Anderson?
MD Anderson.
MD Anderson, and he's in the process of a 6-week, everyday directed radiation treatment. That is something that, do you do that right here?
Absolutely. And then now, as Pauline said, with all of our new advances in the radiation oncology equipment, with our IGRT, which is image-guided radiation therapy, in other words, the radiation can be delivered and takes into account patient's respiration and patient's motion. We can much more accurately deliver this radiation dose that targeted exactly where that cancer is. With our CyberKnife, again, a higher level of technology that is able to target more specialized types of tumors in areas of the body that we typically were not able to get to, both surgically or with our conventional radiation oncology equipment. So at this point, the cancer can run, but it cannot hide from us.
What about the experience of the doctors using all this high-tech equipment now, locally?
Well, we've always had the fellowship-trained physicians as part of our cancer team for a number of years now. These are all fellowship-trained physicians specializing in cancer delivery. And now we've been able to marry that humanistic cancer team of physicians with our new technology into the best symbiotic relationship to be able to help patients with cancer here in Broward County without, again, having to go to those specialized centers that up until now were not available for treatment.
Now, the bottom line to all this, with all this specialized equipment and trained doctors, early detection still is the key, is it not?
Absolutely. The earlier we can detect these cancers, the more targeted our treatment can be, the less invasive those treatment options can be, and also the much better long-term survival for a lot of these cancers.
How much further are we today, say than in 10 years ago, 1999, in detection and treatment of different kinds of cancer?
Actually, we've seen an exponential growth in terms of the technology and our ability to detect these cancers at the earliest possible level. For every decade that passes, our ability to target these cancers and find them at an earlier level has decreased, whereas before it would take hundreds of years to make these kinds of advances. We're now making them by decade by decade.
Doctor, thank you very much. Pauline, thank you. And we want to remind you, NBC6 will be holding that special cancer phone bank tomorrow from 5 to 8 p.m. During that time, you can call in and get your specific questions answered by doctors. Also tomorrow, we want you to tune into our special half-hour informative cancer broadcast beginning at 7:30, hosted by Pam Giganti and me. Kelly, over to you.